right, welcome back everybody right here to the Now Morning Show. Good morning one more time to our Facebook family there on the Now Morning Show Facebook page. We're just so happy that you're all with us this morning, and we're going to speak on a big topic this morning, and that is the arrival of 100,000 vaccines. And we're speaking of the Oxford Astrazeneca vaccine that will come in and will be rolled out in due time. And we're going to be chatting this morning about that with Dr. Erica Wheeler, who is the WHO PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning and welcome.
Good morning. How are you today?
Always great to have you with us. I'm doing great, and I have so many questions as pertains to this topic this morning because, it seems like there's some good news happening.
Yes, absolutely. So over the weekend, we were informed in Trinidad and Tobago, both PAHO and the government, that there will be a shipment and allocation of the AstraZeneca vaccine that will be allocated to Trinidad and Tobago. Now, there is still a need for the emergency use listing by WHO, but that will happen. The schedule for that is 2 weeks' time.
Okay.
So we will be getting vaccines in this first wave for Trinidad and Tobago.
Now, with 100,000 vaccines, that means 50,000 people can be vaccinated because it's a 2-dose vaccine.
Correct.
Right.
Correct.
And what does 50,000 people being vaccinated here in Trinidad and Tobago mean for the country as a whole?
Okay, so the global recommendation is that we begin vaccination in countries with those people who are most exposed or who are most vulnerable. Okay. So we will be looking in the first instance at healthcare workers, the frontline workers, those who take care of patients with COVID-19. We will also be looking at the older population because they are also a vulnerable population. And after those two groups, the next group would be those persons who have what we call underlying health conditions, such as non-communicable diseases, diabetes, hypertension, and so on.
Right.
So the first wave of vaccines should go to the healthcare workers and then work their way across the other groups. So those three groups are seen to be the most vulnerable. It has been agreed globally by the scientific committees in WHO that these should be the groups of people, those first three categories, to receive the vaccine. But of course, we know that is a small percentage of people. So the idea after that is to keep rolling out the vaccine. So it doesn't stop there, but that is where it begins. There may also be some other frontline workers included in there, but that will be the decision of the government.
Right, wonderful. And, now with the vaccines, there are people who are on both sides of the fence with this. There are some people who are saying that they certainly want to get the vaccine, and there are some people who have some fears about getting the vaccine, because there have been reports of people who have had allergic reactions to certain vaccines, not necessarily this one, but like vaccines such as the Moderna vaccine and such. Are there any worries, you would say, anything that the public needs to be concerned about, rather, when it comes to the AstraZeneca vaccine?
No, we have not seen any unusual data, but we must remember no human being is a rubber stamp of another one.
Right.
So if there are people who in the past have received any negative reactions, they are expected to let the health facilities know. But there is nothing unusual. It is not a mRNA vaccine like the Pfizer or the Moderna.
Okay.
It's a different type of vaccine, and it's based on the common cold, but it's got the spike protein of the SARS-CoV virus that elicits an immune response from the body. But the normal types of reactions for vaccines are, a bit of pain and swelling at the jaw, at the point of the injection, soreness. Sometimes persons may have a mild fever, but these things pass after 48 hours. But as in all vaccines and all medications, they're what we call contraindications. But as far as we have seen from the data, there is nothing unusual and no cause for persons to worry about taking the vaccine.
All right, that is great news so far. And let's speak now about people who have already contracted the COVID-19 virus. Would the vaccine be recommended for somebody who had already contracted COVID?
Well, at this point in time, at this point in time, it is recommended that a period, I have to check the exact dates, if it's 30 days or more, that one waits. Because obviously what we want to do is to make sure that those who have not had the vaccine and who are more vulnerable are first in line. So they are not priority people at this time. I mean, of course, there's more research going on constantly about the length of time that it takes, to build immunity, or how not to build immunity, sorry, how long immunity would last.
Right.
But for those persons who have already had COVID-19, they are not the immediate group to be vaccinated. There's still work going on to understand this virus. We know that after a person receives the first dose, they start to produce antibodies, but the percentage of protection only goes up to the required amount that the manufacturer states after the second dose. So it is recommended that those persons who have had COVID-19, they should not be the absolute first people to receive the vaccine, because they already would have antibodies in their system against the vaccine. But if you've had the flu vaccine, you can have it, but you have to wait at least 7 days before you get the COVID-19 vaccine. So you can get the COVID-19 vaccine after you've had your flu vaccine, but you have to wait that 7-day period.
Is it possible to contract the COVID-19 virus even after getting the vaccine? Is there any possibility whatsoever?
Well, they know there is this difference. You can have a vaccine and not develop the disease, your COVID-19 vaccine, but you may still be able to have the virus and pass it on. It's just that you don't become ill. This is just the nature of the COVID-19, the disease. So at this point in time, we are not 100% sure what is the rate at which people who've had a vaccine can actually become reinfected. That is not, it's so early. We've only just started in most parts of the world giving out vaccines. So we need time to study this phenomenon and to understand how the vaccines work. Because remember, there are also different vaccines with different levels of efficacy. So this would be an ongoing study over the course of certainly the next year and beyond before we can make any such definitive statements. But I don't think people should shy away from getting the vaccine on the basis that they may still get COVID-19. And remember, when we talk about the efficacy of the vaccine, meaning the ability of the vaccine to stop persons from becoming ill with the disease, we certainly saw with Pfizer and Moderna, it's 95% effective, not 100%. There's no vaccine that is 100% effective. So there will always be a small number of people who may still contract COVID-19, but they would not necessarily die from having COVID-19, because the idea of this first phase of vaccination is to stop the acute phase of the pandemic.
And let's speak quickly about variants. Now, we know that, say, for instance, things like the flu vaccine, it has to be tweaked to be adjusted for the mutations of the flu virus itself. Would it be the same for the COVID-19 vaccine, where we are seeing variants coming out of the UK and other strains coming out of Australia and the like?
Yes.
South Africa, and the like.
Yes, and that is happening already. As you read the literature, you would see, and the news reports, that the various vaccine manufacturers have already started adjusting their vaccines to ensure that they address the variants of the virus. So this is normal. It's just that it is happening in a very short space of time. Well, mind you, we've now had COVID-19 with us for a year. And when you think about it, every year we get the flu vaccine, as you yourself mentioned, it is adjusted so that this is not something that's unusual. And the vaccine manufacturers know this, and they are already working on adjusting their vaccines to address the new variants.
Right. Dr. Wheeler, I want to thank you so much for keeping us in the know this morning. And we're going to chat with you again very soon, especially as we come closer and closer to the time when the vaccine will actually be here in the country. But one more time, I want to just say thank you and have a great morning.
Thank you. Thank you very much. Okay.
All right, that was Dr. Erica Wheeler, WHO PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands, giving us an update as pertains to the COVID-19 vaccine arriving here in Trinidad and Tobago very soon and how the rollout of that would be. We're now going to take a short break and come back with much more. Stay with us.